Hello, friends. I'm back again with the same topic. As it is obvious, no other topic demands such respect and importance as COVID 19 or coronavirus. So, COVID 19 or the coronavirus, as we know, has been an unprecedented catastrophe being witnessed by the world. It has shaken the very core of human race. Never have the humans witnessed such an pandemic. So the very important question of the present times is what is being done about it? Do we have any remedy? Well, we can say that never have ever human race seen such a pandemic and nor such widespread measures being taken at such a global level and such a massive scale in the absence of any vaccine or specific treatment. The research in the development of vaccine is being pursued all over the world, and as a result, the information we have about the disease is changing every day. This pandemic, which is onset upon us, has led to the deaths all around the world, and the toll just keeps on rising. The latest data, as per the WHO report, reveals that as on 30th March, the total number of coronavirus infected patients around the world have been 7 lakh 1,735 and the deaths have been around 35,000. So the main question is what is being done about it? The WHO on 27 March in its press statement issued information regarding its solidarity drug trial. Patients which have been selected are from Norway and Spain. They will compare the safety and effectiveness of the four different drugs chloroquine and hydroxychloroquine and ritonavir, interferon beta, and others, and in their combinations as well.
Today, we're delighted to announce that today in Norway and Spain, the first patients will shortly be enrolled in the Solidarity trial, which will compare the safety and effectiveness of four different drugs or drug combinations against COVID-19.
A study has been conducted in Beijing in PLI General Hospital, which revealed that patients with mild COVID 19 infection still had coronavirus even if the symptoms disappeared after being treated. The study further revealed that the novel coronavirus was present up to 8 days even after showing no symptoms after being treated. Sometimes no symptoms were seen in the patient, but when tested, antibody response showed that the virus was still present. All these things contribute to the fact that this is difficult to control. That is, this is why it is difficult to control. So, the $1 million question is that what is to be done next? It is a proven fact that more than general population, the most people who are at risk are the health workers. They have been given a guideline by the WHO to treat every patient as suspected patient and don't be complacent. World Health Organization has supplied protective gear to about 74 nations and are looking forward to provide it to 60 more nations. WHO has said if the health workers are at risk, especially in no low and middle income nations, since they deserve the same protection as wealthy nations, everyone is at risk. So, why is the situation so grave? If we look at USA, it took USA 1 month to reach 1000 deaths, but only 3 days to reach 2000. Number of deaths Italy has also shot up to 1799 with an average of 400 to 500 deaths daily. At global level, there have been 7,31,735 total cases and around 35,000 deaths. Therefore, the situation is very grim and alarm bells have been rung since December. The factor that these nations showing high rate of deaths are a very is can be attributed to the fact that they are very good tourist destinations and timely alarm could have mitigated the loss. That is why some nations like USA have been blaming China for this very fact. So, what are the countries doing around the globe? City of Wuhan has been slowly resuming its old status and resuming all its services that had been stopped. Other nations are also taking necessary action like lockdowns, social distancing measures, dedicated hospitals and blocks. Many measures on easing economic reins have also been undertaken. So, finally, we can say that in the end, it must be said to contain it would be an Herculean task, which is not impossible but would test our resolve as humans.